Data to Care is using surveillance data and other data sources to try to identify people who have fallen out of care.
Data to Care is a new way to look at our out-of-care individuals by intentionally going back out and trying to find people who are out of care or who never linked up to care.
The HIV surveillance system in the United States has been around for a long time. Since really 2008, we've had this very comprehensive name-based surveillance system. This shift to actually looking at the data at the individual level as a tool to be able to find people who are potentially out of care and linking them into care is definitely a big shift in how we thought about using surveillance data.
We are looking at that surveillance data and we are trying to get people back into care because we do know that we can then stop the transmission of the virus if we have people having non-detectable viral loads.
And what that looks like is that we use surveillance data to identify the clients who have not accessed care. So basically what we've done is looking at the data to drive where we need to go to identify clients that we need to touch so we can get them in care so that they can get the treatment that they need so that they can't become virally suppressed.
Each state, each city has a very different landscape. The community dynamics and who's at risk is different, and how many people are living with HIV in their jurisdiction. And so having one national protocol for how you do data care probably would not be very effective. People need to have the flexibility to make it work for them in their own communities.
In Louisiana, currently we have about 22,000 people who are living with HIV, and at the end of 2017, Louisiana ranked 4th in the highest rates of infection of HIV. That makes it that much important to have a data to care strategy in Louisiana, and that makes it that much important. The work that we do surrounding our data to care systems and with our links to care coordinators.
Data to Care was first rolled out with just a handful of health departments through these demonstration projects to see how effective it was. It's a lot of work to find people, but they were successful in finding people and linking them back into care. We decided that it is worth the effort to do this work. Based on the positive results from our pilot projects, we decided to roll out the Data to Care activities across the United States. Now, our big initiative at CDC is that with our new cooperative agreement with all the health departments, Data to Care is a required activity. So we're now rolling this out nationwide. We're also working on developing new tools and different technical assistance to help as much as we can with rolling out this new activity to all health departments, as well as developing an evaluation plan so that we can make this the most effective program that it can be. Our hope for Data to Care was that these programs will keep on improving, become more efficient, and be able to relink even more people back into care, and we can dramatically increase the percent of people who are virally suppressed or living with HIV.